Welcome back to the booth here at OSCON. My guest is Jason Goldwater, Health IT Project Manager at the N.O.R.C. at the University of Chicago. Before I get started with the interview, I just want to let you know we've got something different coming up in a few minutes after our talk, a Perl versus Python debate between Steve Holden and Peter Scott. Please stay tuned. So, welcome to the booth.
Thank you.
I gather that, to give some context here, the Office of the National Coordinator for Health IT commissioned a study and report on the availability of open source health IT technology.
Right.
And they did that because the HITECH Act, which passed in 2009 as part of the stimulus bill, said you needed to go look into this.
Right.
So, what were the most important findings from this research?
Well, I think there were probably three that really stuck out. I think the first is that we saw in community health centers and safety net settings, which primarily serve Medicaid beneficiaries or Medicare beneficiaries, really underserved populations, that open source EHRs were really a very viable alternative to some of the more proprietary systems. These centers don't really have a lot of money, can't really afford the $10 to $20 million system. And open source really provided the same functionality and the same features that an Epic system would provide or a Cerner system would provide. I think the second is we really saw these community health centers use their open source technologies in a way to redesign their practice. Rather than just using it as a way of coordinating care, they would use it for chronic disease management, connecting with social services, using it for clinical and non-clinical components of care, really taking care of their individual patients from on the complete spectrum. I mean, really preventative care and then the immediate clinical need of why somebody comes in. And I think the third thing we really found out as well is that the government really should understand more about open source, and I think that the community needs to understand more about open source. There's a lot of really good HIT projects that are going on, and unfortunately not a lot of people really know about them, and I don't think the government really knows about them. And I think if word got out there and people understood what was going on, it's not meant to replace proprietary systems, but I think for those that are really cash strapped but want to be electronic, it really is a viable alternative for them.
That's not an uncommon concern right now, right?
Right.
Resource starvation is a problem across the government. As we know right now, there's a debt ceiling debate on budget. But we know that open source isn't free in all the ways we might conceive of it. What were the findings in terms of weighing the total cost of ownership of open source EHRs versus proprietary solutions?
Well, I think a common misperception, as you said, is you hear the word open source, you assume it's free and it's not going to cost anything, and that's not, of course, true. So what we found is that the acquisition of the software generally is free. I mean, you can either, if it's a government system like the Veteran VA system, the VistA system, you can simply do a Freedom of Information Act request and get the source code. And if you actually know what you're doing, you can install it yourself. Most individuals, most organizations, most community health centers don't know that. So really what we found in terms of cost was the cost came down to installing the software, purchasing the hardware to put the software on, and then the implementation, maintenance, and support. And overall, our analysis really showed that it was about 60% less from a total cost of ownership perspective using an open source system versus a proprietary system. So it was a substantial figure. And that was largely because some of these open source systems really don't require an awful lot of maintenance once they're installed. I mean, updates can be done in the general ecosystem. People will be constantly contributing to the code base. There can be recycling or reusable components, whereas sometimes with the proprietary system, they'll have to come in with their consultants and do some reconfiguration themselves, and they charge you for that. With open source, there might be a charge, but there's also a lot of community development which offsets that.
So when I've spoken to hospital CIOs or administrators, people who are on the health IT side, one of the concerns with EHRs that seems to come up again and again is interoperability between systems.
Right.
Where does the open source offering stand in that context?
Well, I always find that an interesting conversation because there's one electronic health record that has been shown to be fully interoperable in hospitals across the country, that has the full functionality of most of these commercial systems, and it's been around for almost 4 decades, and that's the VA system. So when you're using a VistA system, it's fully interoperable, it can be interoperable, because it adheres to nationally based data standards for messaging and vocabularies. I think in terms of overall interoperability, I don't think there's that much significant difference between open source and proprietary. I would say the difference is that as we move toward more national standard, open source will have an advantage because A, there's a community that can build those standards, build the technology around those standards, and B, there's less of a motive to not be interoperable. When you have a proprietary system, of course they want to be interoperable, but with themselves. They want all of their systems to interconnect. They don't necessarily want to interconnect with other systems because it might diminish the profit motive. With open source, that's not really the case. They're not necessarily there to make a substantial profit. It's there to improve and improve the health of the citizenry that's seeking services, but also I think to create a more viable electronic base for a community health center or a hospital or a physician practice that's of lower cost and more viable, and obviously something that's been proven to work.
Now that last point's the interesting one, right? The HITECH Act and stimulus sets forth something on the order of $20 billion, but it's been flipped around a little bit this time. Anyone who implements these once EHRs has to demonstrate meaningful use of the technology in question. The question that any CIO will ask then is, can open source electronic health records meet meaningful use requirements?
Well, there's several that have been certified for meaningful use, and there's a couple of vendors here that have open source electronic health records that have been certified, and World VistA, which is a major VistA vendor, just became certified for meaningful use. Open VistA, which is another VistA derivative that's run by the MedSphere Corporation in San Diego, or Carlsbad, California rather, they've also been certified. Clear Health, which David Ullman is actually here, they've also been certified. So the answer is they're just as certified as a Cerner, an Epic, or any other system. It just comes to a question of, do you have the right functionality to meet meaningful use? And then will you be able to evolve to meet meaningful use in stages 2 and 3 later on? And that's where I think there is also an advantage to open source, because there's a growing community that will be able to do that evolution and really do those modernizations and updates as meaningful use continues to evolve. So I think the answer is yes, they're perfectly certifiable and can be used in a meaningful way, and probably will be able to be extended to do so in the future.
So, and this is, go to the last question here, and I think it's the open one, right? You described some financial rationales here, said that these meet meaningful use requirements, that there's interoperability advantages. There's a lot of, I think, a lot weighting this down in the positive side.
Right.
What are the challenges towards adoption of open source EHRs then in the health IT systems around this country and frankly around the world?
Well, I think in this country in particular, there's a couple of barriers to adoption that are unique to open source. The first is this misperception of open source, which is you hear the term open source in front of anything at times, and people will connotate sometimes a negative viewpoint of it's somebody in their basement doing code, which is obviously not true. I think the second one is that open source is also viewed as having a less robust development process than a proprietary model, which is also not true, because there's a lot of companies around here that I'm sure have very sophisticated development models just like anyone else does. So I think those are two major barriers to adoption of open source. Add that to a lack of understanding of what open source is doing in the area of health IT, and then add to the general area of physicians or providers not adopting electronic health records just overall because of the disruption to workflow, the possible loss of productivity. I think those are the barriers to adoption, why we don't see a lot of open source EHRs across this country, even though there's one that's been proven to have worked for a very long period of time. I think internationally it's a very different story. I think the Canadian Health Infoway and the National Health Service have an open source backbone. They have toolkits to develop open source tools. I think if the United States was able to follow that example, you would probably see a greater uptake in adoption, but there's a need to really understand how they did that and how they became successful with that before we really understand how to be implementing that here.
Okay, well that was Jason Goldwater, Health IT Project Manager at the N.O.R.C. University of Chicago. He was talking about a new report on the open source EHR world that they've released. You can find more information about that and him at oscon.com.